we're going to look at the classification of the anticoagulant. So here we're going to have some questions. The first question is, what happens in the intrinsic pathway? The second question is, what is a factor 10 also known as? So we'll find out these answers in this video and learn in detail. So firstly, the anticoagulants. So under this, we are firstly looking at the intrinsic pathway. So under the intrinsic pathway, what happens is there is something known as the factor 12. So 12 is converted to 12A. So how is this possible? So this is possible with the presence of the collagen. And next there is also the kallikrein. There is the kallikrein. And beyond the kallikrein, there is also the HMWK. So all this acts on the 12. So 12 is converted to 12A. And then when you see this 12A, it helps in the conversion of the 11 to 11A. And after this, the 11A, so 12 and then 11. So 11A helps in conversion of the 10 to 10A. And 10 to 10A is done. And what is the added here? So calcium is added here, is required in this process. Next, when we move on, there is also the action of 8. There is factor 8. So 8 is converted to 8A. So this is in presence of the thrombin. This is in presence of thrombin. So why am I telling this? Because the factor 8, it adds on to the 9A. So we discussed that 12 is converted to, helps in the conversion of 12A, and 12A helps in the conversion of 11 to 11A. So this along with the 11A. 11A gives rise to 9 and 9A. So in presence of 9, the 9A, it adds on to the 8A. So 9A and 8A are added along with the calcium. So it's 9A and 8A added along with the calcium. So then this leads to the something known as a common pathway. Then it goes to the common pathway. So what happens in the common pathway? The common pathway we have, so everything joins, it enters the common pathway, and this is nothing but 10. So 10 is converted to 10A. And then we also have, after the 10A, the 10A goes and acts on the 2. So 2 is converted to 2A. Then on the other hand, there is something known as a thrombin. So thrombin, it helps in the conversion of the 5. It helps in the conversion of 5 to 5A. So this is what the thrombin does. And this 5A, it again acts in the process of 10A. So it adds on to the 10A. This is the 5A adds on to the 10A along with the presence of calcium. So then the 2 to 2A is converted. So what happens after 2A? So then after the conversion of 2A, then what happens? The 2A helps in the conversion of 1 to 1A. And next, there is another role of thrombin. So this thrombin, it helps in the conversion of the 13. It helps in the conversion of 13 to 13A. So this is what the thrombin does. And after this thrombin, it acts on the 1A. The thrombin acts on 1A. And after acting on 1A, it along with the calcium. So then it forms a stable fibrin clot. Then what is formed? A stable fibrin clot is formed. So the same thing, we saw the intrinsic and the common pathway. Next, we'll look at the extrinsic pathway. This extrinsic pathway also, if you see, this extrinsic pathway, it leads on to the common pathway. So firstly, the extrinsic pathway, there is 3 to 3A. So this 3 to 3A is in presence of the endothelial damage. It's presence of the endothelial damage. So after the endothelial damage contributes to the movement of 3 to 3A, and after 3 to 3A, then on addition of calcium. So everywhere there is presence of calcium. So on presence of calcium, and on the other hand there is also the factor 7 to 7A. So this factor 7 to 7A also contributes to this step, and then this everything it acts on the factor 10 to 10A conversion. So 10 to 10A conversion. So this 10A, this is where the entry of the common pathway takes place. Common pathway. So now we are looking at some inhibitors. We look at some inhibitors. So the inhibitors of the factor 10A. So factor 10A inhibitors, what does it include? It includes they are oral. Under oral, it includes the rivaroxaban. It involves the rivaroxaban. Next, it also includes the apixaban. Apixaban. Then the edoxaban. Edoxaban. And parenteral, it involves the fondaparinux. Fondaparinux. Then we look at this factor 10A inhibitors, as the name suggests, inhibits 10A. Then we look at the direct thrombin inhibitors. So direct thrombin inhibitors. So what does this direct thrombin inhibitors do? So direct thrombin inhibitors are nothing but it inhibits the 2A. It inhibits the 2A. So what are the examples? So examples include, so firstly there is oral. So under oral it includes there is the dabigatran. So there is dabigatran. Next comes the parenteral. So what is included in the parenteral? So parenteral, it includes the argatroban. Next, it includes the lepirudin. Then also the bivalrudin. So all these are included. Next, we'll be naming some factors. So naming the factors, the first factor is 1. So 1 is nothing but the fibrinogen. Then 1A is nothing but the fibrin. Next, 2A. 2A is nothing but the thrombin. Then 2 is nothing but the prothrombin. Next, 3. 3 is for the tissue factor. Then after 3, we look at 5. 5 stands for the proaccelerin. Then what about 7? 7 stands for stable factor. It is stable factor. Then comes the 8. 8 stands for the anti-hemophilic factor. This is A. After 8 comes 9. So 9 is nothing but the Christmas factor. The Christmas factor. Then comes the 10. So what is 10? 10 stands for the stored power factor. Stored power factor. This is nothing but 10. After 10 comes 11. So what is 11? 11 is for nothing but the plasma thromboplastin. So after 11 comes 12. 12 is nothing but the Hagman fracture. Hagman factor. This is 12. So now we'll be answering our questions. So first question we asked was, what is the intrinsic factor or intrinsic pathway? So in the intrinsic pathway, what happens is there is the 12. There is 12. 12 is converted to 12A. And what happens after that? So 12 to 11. So 11 is converted to 11A. So what happens after 11? So 11 helps in conversion of 9. So 9 to 9A is converted. And then it enters the common pathway. So in between there are some additions. So what is it? It is the collagen. Next comes the kallikrein. Collagen, then comes kallikrein, then comes the HMWK. So what does all this do? So all this, it adds on to the factor 12 conversion. So factor 12 is converted to 12A in presence of these. And then we have, on the other hand, we have factor 8, which also plays a role. So factor 8 is converted to factor 8A. So factor 8 to 8A. And then what happens is this 8A is adds on to the 9A. And this has an addition of calcium as well. So calcium is added along with this. And it enters the common pathway. And there is also the extrinsic pathway, which adds on to the common pathway. Now we are going to look at the other question, that was what is factor 10 also known as? So the factor 10 is also known as the SWOT. It is known as the SWOT power factor.